All right, Mark. Oh God, I don't like that camera in there. Okay, think I got it now? All right. All right. Okay. All right. All right. Hello there. How you doing today?
Good.
My name is Teresa, and I'm gonna be your nurse today. I gotta make sure I can see, camera can see. My name is Teresa. I'm gonna be your nurse today. Okay. And your name?
Shamar.
And how old are you, Shamar?
17.
17. All right. I understand you're here today for a facial, a head. Well, say head, facial, neck, eyes, ears, nose, and a throat assessment. All right, so we're going to go ahead and get started. I'm going to go ahead and sanitize my hand. All right. All right, first thing we're going to do, I'm going to go ahead and assess and palpate your head, okay? All I'm doing is looking for any lumps, bruises, lesions, anything out of the ordinary. Your hair is nice and black, okay? Um, Open up just to check your scalp, okay? No lesions noted, no dandruff, okay? No sores, okay? All righty, sir. All right, anytime during the assessment, if you feel uncomfortable, you just let me know, okay? And we'll go. All right, so the next thing I'm gonna do, I'm gonna go ahead and check your temporal artery, okay? Any tenderness there when I palpate? No? Okay, next thing I'm gonna do, I'm gonna go ahead and check cranial nerve number 5, which is your trigeminal nerve, okay? All right, so go ahead and open your mouth, close it. All right, grit your teeth. All right, very good. And while I'm at it, I'm gonna go ahead and assess cranial nerve number 7, which is your facial nerve. So go ahead and smile, frown, puff up. All right, let go. All right, sir. All right. Next thing I'm gonna do, I'm gonna go ahead and assess your face, just looking at it, just looking at your eyebrows, your eyes, your nose, your mouth, and your ears, just making sure it's symmetrical. You know, they all in line with each other. Okay. First thing we're gonna do, I'm gonna go ahead and assess your eyes. Okay. So go ahead and I'm look at your eyebrows. Okay. Nice and clean, no drainage. Close your eyes for me. Look at your eyelashes. Get your eyes open up for me. I'm gonna look at your conjunctiva. Okay, nice and pink. Look at your conjunctiva on this side as well. Okay, nice and pink. All right. Your sclera is nice and white. Your iris is nice and brown. Okay. Go ahead. I'm gonna assess your Go ahead. I'm gonna assess your cornea. Look at it. Make sure it's nice and round and not concave. All right, that one nice and round and not concave. Look at this one right here. All right, nice and round and not concave. All right. Next thing we're going to assess is cranial nerve number 2. Can you go ahead and read that for me right here?
Alcohol prep pad.
All right, alcohol prep pad. Very good. Okay, thank you. All right. So, all right, there's no drainage or nothing into your eyes, okay? So, next thing we're going to do, I'm going to go ahead and assess your nose, okay? Looking at it from the outside, your external nose is nice and midline, no problems. Tilt your head back for me. I'm going to go ahead and look at your nasal area. All right, you look at your mucosis in your nose, which is nice and pink, all right? Your spectrum is nice and midline, okay? Thank you. Go ahead and tilt your head back. We're going to do cranial nerve number 1, which is your olfactory nerve. Tell me what you smell.
Alcohol.
All right. Okay. Thank you. That's cranial nerve number 1. Okay. Next thing I'm going to assess, okay, I'm going to go ahead and assess your frontal sinuses, which I should have done that in the beginning, but I'm doing it now. I'm going to assess your maxillary sinus right here. Any tenderness or any pain when I did that? No. Okay, we're going to go ahead and assess your ear. Look at your external ears. Make sure there's no drainage or leaking. And I don't see any. I'm going to go ahead and assess this one as well. There's no drainage or leaking to that side either. All right. I'm going to go ahead and assess cranial nerve number 8, which is your costal nerve. Okay. So go ahead and you put one hand over your ear for me. And I'm going to whisper something in your ear and you just tell me what I said.
Football.
All right. Do the next one.
Basketball.
All right. Thank you, sir. All right. I'm going to go ahead and palpate your external ears. Any tenderness or any pain there? No? Okay, now I'm going to go ahead and assess your internal ears and look for any drainage or anything. Okay, no drainage on that side. All right, no drainage on that side. Okay, now we're going to go ahead and assess cranial nerve 3, 4, and 6. Okay, your cranial nerve 3 is your costal nerve. Cranial nerve 4 is your trochlear nerve, and cranial nerve 6 is your abductus nerve. Okay, all right. Okay, so next thing we're gonna do, I'm gonna look at your mouth. Okay, look, we're gonna open up. All right, I'm gonna look inside. All right, looking at your teeth. All right, looking at your gums. Okay, nice and mouth nice and clean, gums nice and pink. Your buccal mucosa in your mouth is nice and pink and moist. Okay, looking at your hard and your soft palate. Would you open up, please, sir? The hard and soft palate. Okay, stick out your tongue for me. Looking at your tongue and looking at your tonsils. All right, go ahead and close your mouth. All right, let me turn that off. We're gonna go ahead and do cranial nerve number 9, which is your hypoglossia pharyngeal. All right, go ahead and swallow for me. All right, very good. We're going to do cranial nerve number 10, which is your vagus nerve. So go ahead and open up for me and say ah.
Ah.
All right, let me look in it again. Open up and say ah.
Ah.
All right, good, very good. Okay, we're going to do cranial nerve number 12, which is your hypoglossia nerve. Go ahead and stick your tongue out. Move it from side to side. All right. Say light, bright dynamite.
Light, bright dynamite.
All right. Thank you, sir. Okay, we're gonna raise your neck for me. We're gonna go ahead and palpate your trachea, which is nice and midline. No lumps, bumps noted. Okay. Any pain when I palpate your trachea? Okay. So we have to assess your neck. I'm gonna go ahead to the back and assess your okay. All right, I'm gonna assess your thyroids in the back. So go ahead, tilt your head for me. Tilt your head for me. Tilt. That means bring it back, sir. All right. Okay, go ahead and swallow. All right, so turn your head to the right. All right, swallow for me. All right, turn your head to the left. Go ahead and swallow for me. Okay, thyroid is nice, no nodules or noted. Your thyroid is nice and midline. All right. So next, I'm gonna go ahead and assess your lymph nodes. Okay. So your first lymph node is your pre-auricular lymph node. Your post-auricular lymph node. Okay. Your occipital lymph node. Your posterior cervical lymph node, your superficial cervical lymph node, your deep cervical lymph node, your jugulogastric lymph node, your submandibular lymph node, and your submental lymph node. This completes our assessment. Your head, your face, your neck, your eyes, ears, nose, and throat assessment. Thank you so much. Any questions? All right, thank you. Have a good day. You too. Okay, now I'm gonna go ahead and do a report on the 17-year-old male that came in to have his. Hold on, y'all. I'm gonna go ahead and do a report on a 17-year-old male that came in to have his head, his face, his neck, his eyes, ears, nose, and throat. Eyes, ears, nose, and throat assessment done. First thing we did, we went ahead and assessed the head. His head was nice and clean. His hair was black, no nodules, no lesions noted, no dandruffs or anything of that sort noted to the head area. Okay, after we did the head, we went ahead and assessed his temporal, um, his frontal, and his maxillary sinuses. They was all intact, no problems in that area. Next thing we assessed was his cranial nerve number 5 and cranial nerve number 7. They was in both intact, no problems in those areas. Next thing I assessed was his nose. I assessed his nasal passage, his mucosis for his nose was nice and pink and moist. No drainage noticed. His scepter was nice and midline. All right, next thing I assessed, well, that's the nose. But I assessed his eyes. Okay, his conjunctiva was nice and pink. His sclera was nice and white. His iris was brown. No drainage or anything noted. No redness noted to the eye, bilateral eyes area. His cornea was nice and round and not concave. It was assessed both corneas was assessed using the flashlight, and they was not concave at all. Next thing I assessed his ears. His external ears was nice and midline. His no upon palpation of both of the earlobes, there was no tenderness noted. No drainage noted in the internal ears, no drainage noted there. He was able to pass cranial nerve number 8. I did assess cranial nerve number 2, number 4, number 3, number 6, which he passed all those. Then I went on down to his mouth. Okay, I assessed his lips, which was nice, pink. No lesions noted on it, no sores noted to his lips. They was nice and they was dry on the outside. Then I assessed his oral cavity. I assessed his mouth, his teeth, his hard and soft palate. I assessed his tongue and his tonsils, his teeth and his gums. They was all intact. His mucosis for his mouth was nice, pink and moist. Cranial nerve 9 was intact. Cranial nerve 10 was intact, and cranial nerve 12 was intact. I assessed his neck area. His anterior neck with his trachea was assessed. His trachea was midline, no tenderness noted to palpation. Then I assessed his thyroid. I went to the back of his neck. I assessed his thyroid. No nodules noted. No pain upon palpitation. Then all 10 lymph nodes was intact. No problems there. This is my assessment. The 10 lymph nodes that was intact. This is my assessment. Thank you.